अंडरबाइट किसको कहते हैं एंड अगर आपको अंडरबाइट है उसको कैसे करेक्ट कर सकते हैं. Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. In today's video, I will explain underbite होता क्या है and if you have a underbite then इसके आपके पास treatment options क्या हैं. So beginning with underbite होता क्या है. As you can see in this skull, this is your skull, this is your lower jaw, this is the upper jaw. As you can see, the lower jaw is ahead of the upper jaw, whereas in a normal jaw, the upper jaw is ahead of the lower jaw by 1 to 2 millimeters. If you feel you have an underbite, what is the first thing you need to do? Well, the first thing is you need to identify an oral and maxillofacial surgeon who can help you in this problem. When you come to an oral surgeon, the first step is a clinical examination. We see how your teeth are, we see how the occlusion is in very technical words. We then advise you to get certain x-rays done. At the diagnostic stage, where we are just trying to see the extent of the problem, a lateral cephalogram analysis and an OPG analysis is more than sufficient to form a treatment plan for you. In a lateral cephalogram analysis, we do the analysis and we find out the 2D positioning of the jawbones with respect to the skull and with respect to each other. By performing this analysis, we are guided into knowing whether the lower jaw is indeed forwardly placed compared to the upper jaw, or whether the upper jaw is in fact receded or backwardly placed. Depending on what we find in our cephalometric analysis and what we see clinically in you as a patient, we go on to the next step, which is formulating the treatment plan. The treatment plan is divided into the degree of the problem that we find in the above two analysis. So you may either fall into mild underbite, you may fall into moderate underbite, or you may fall into severe underbite category. Well, the first category, which is mild, can be easily handled by braces or orthodontics alone. It is in cases of moderate to severe category that you need a kind of orthognathic or jaw surgery. The jaw surgery is typically of 3 types, depending on what we find in our analysis. It can either be the advancement of the upper jaw, it can either be the setback of your lower jaw surgically, or in severe cases, it might be a combination of both. That means the upper jaw also needs to come in front and the lower jaw needs to be set back. Whatever the surgical treatment option we go by, it is always succeeded by post-surgical orthodontics or post-surgical braces. This ensures that after the surgery, the teeth meet in such a way that there is no chance of relapse. The post-operative period is typically of 4 to 6 weeks, where you have dietary restrictions, limited movement allowed of the jaws, and certain restrictions in your overall activity. If you have underbite and if you're also looking for treatment options, please do leave in a comment, subscribe to our channel and like.